Hello and welcome back to the EMDR Doctor podcast. I'm Dr. Caroline Lloyd, and today I'm going to chat to you about how EMDR can help sleep. Great question, and put to me by one of my beautiful clients. So I am going to cover a couple of different aspects of sleep today: anxiety, nightmares, and parasomnias. So obviously here I need to start with the fact that EMDR can't help some causes of sleep disruption, like a snoring partner or a newborn baby or menopause, for example. But we can definitely work on the psychological causes for insomnia. Now, we all know that EMDR helps anxiety, and anxiety impacts sleep quite substantially. Most people will have an experience of this, like, for example, not being able to sleep the night before an exam or an important event, or on a day where something has gone a little bit awry. So if you're worrying about tomorrow or catastrophizing about something in your life, then it can be quite hard to get to sleep. So EMDR can definitely help you with those issues, both working on the anxiety and also the catastrophizing. So we have a special protocol for worries about the future called the flash forward technique, and that can be really helpful in reducing the concern about something in the future. And we can also work on the future prong. So we talk about 3 prongs in EMDR: the past, the present, and the future, to sort of thoroughly cover all scenarios. And in my work, because I work mainly in a sort of a short-term intervention kind of a way with the inpatient and my outpatient intensives, I often work mainly in the past prong, as this is the best way to kind of drastically and quickly reduce distress. And it's those quick results that I'm after when I think about what's affecting my clients. So anxiety is often reduced with EMDR therapy, and this can improve sleep. So in fact, and this is just a therapist tip here, when I have had a bad or distressing day, I will often do a little bit of self-EMDR, just lying in my bed in the dark, looking from one side of the room to the other, and for the eye movements, and tapping on either my legs or my shoulders for a bit more additional bilateral stimulation, and doing standard protocol on whatever is bothering me. And I know it's working because I'll get a bit sleepy, or sometimes I even will wake myself up by snoring. Then I'll just turn over and go straight back to sleep. And it's such a good self-treatment for insomnia. And aside from insomnia, I want to talk about parasomnias, like sleep paralysis, and nightmares. So we know from the literature that EMDR is an excellent treatment for PTSD. And one of the main symptoms of PTSD is reliving the distressing events, both in waking hours with flashbacks and also at night during sleep. And of course, the usual description of this is nightmares. So as we treat the PTSD, all of the symptoms of PTSD diminish, and nightmares are one of those symptoms. And with my inpatient work, I've found that some people have a really immediate reduction in nightmares. Of course, results differ from person to person, and I'm just giving examples, not specific medical advice here. Sometimes nightmares can actually include the acting out of the situation. And I've personally experienced this with waking up trying to kind of fend off an imaginary attacker or an attacker in my dreams, in my nightmares in the middle of the night. And I've had lots of reports from clients who have experienced it from both sides of that story. So they've either woken up trying to fend off their partner, or they've woken up with their partner trying to assault or attack or even strangle them, which is very distressing for all partners involved. So I'm not saying that their partner was deliberately trying to strangle my client, but in their nightmares they were protecting themselves and that acting out of the nightmares can actually be very, very distressing kind of in real time for anyone who's there in the room with them. Sometimes that can even mean that people have to sleep in different bedrooms for a little while they're waiting for the nightmares to settle down. So, which that in itself is not great for a relationship, but certainly better than waking up being assaulted. So how do we approach nightmares with EMDR? In this situation, I would probably prioritize the nightmares because that's so destructive to the safety of the relationship. And I have found that processing the nightmare as the target is really helpful. So often we find that nightmares have a theme, like being lost in a building or running away from somebody, being pursued, being in conflict with somebody, being locked up. These are a few of the common examples that I come across. And I would just take an image from a recent nightmare or the last remembered nightmare, and we would use that as the target image for the EMDR protocol and just use standard protocol from there. So after that, we would target the actual event, the real life event that caused the nightmares, if that hadn't already been desensitized by the work on the nightmare itself. And most EMDR therapists follow a strategy very similar to what I've just outlined, and most of them would report really great results with this. And it is so good when someone gets some fast traction with sleep, because getting enough sleep is so pivotal to well-being and really important for recovery. So I want to talk a little bit about sleep talking. So sleep talking is another sleep issue that is really common, often seen in teenagers, children as well, and mainly it's kind of incomprehensible mumbling, but the parts that are audible are often a little bit conflictual. So that might indicate that the person who's doing the sleep talking might be having difficult conversations or arguments in their sleep, and potentially emotionally trying to work things out. So I don't know if there's evidence for this in the literature. I haven't done a deep dive into this, but it just makes sense that if we are less stressed about the events in our lives, then we will do less sleep talking. So EMDR could potentially be really effective for sleep talking if this is a major problem. I haven't actually had clients presenting with sleep talking as a problem, so no results to report here, but I would be interested if there was any studies on this. But one really fascinating parasomnia, which I have worked on before, is sleep paralysis. And this is when somebody wakes from sleep and is unable to move. They feel paralyzed. And it can also be, horrifyingly, associated with a hallucination that is like the sense of a really malevolent presence in the room. So people often, if they have this sleep paralysis, they wake from sleep, they're paralyzed, they can't move, and they have a sense of someone awful in the room with them. And sometimes this can take the form of like a demon or the devil, something like that, or it may just be this sense that there is an intruder in the room or someone about to attack you. Now, it's really important here to know that everybody, every night has periods of what's called atonia, which is an inability to move, and this happens during REM sleep. And this is when we dream most vividly. So it is possible that, say, for example, when we're having a nightmare where we're fighting with someone and we feel unable to hit them back, we feel kind of frozen or unable to move and unable to run. It's that classic nightmare, being in the middle of the road trying to run and not being able to get your legs to move. And this is atonia. This atonia is normal, and it's not problematic unless we wake up with the sensation and we wake up with that hallucination of, let's say, a devil in the room. This is terrifying. And that few seconds until our movement returns and we can sit up and turn the lights on and know that there is nobody else in the room is really awful. And I actually do remember having an experience of this when I was a kid. I woke up and I couldn't move and I was just in panic. And even when I could then move, I was too scared to reach out and turn the light on. And I just lay there in panic waiting for something awful to happen. I can't remember the end of that story, but I do remember that sense of lying there panicking and not being able to move. And I have worked with a couple of clients who have been so affected by their sleep paralysis experiences that they've developed a bit of a phobia about going to sleep. So, these are people who wait until 3 o'clock in the morning before going to bed because they need to know that they are so exhausted that they're going to go to sleep as soon as their head hits the pillow because they're really afraid of going to sleep. So with those clients, we've just worked on the difficult experiences that they've had and used the target of waking up feeling unable to move with that presence in the room. And that's resolved really, really nicely. And if you pair that with a little bit of psychoeducation so that people actually know what is happening, the fear of sleep actually really dramatically reduces. So when they wake up in the night, even if they are paralyzed, they're able to say, oh yeah, Caroline told me my movement will come back in a minute. Just start to move my fingers, start to move my toes, and then I'll be able to get my movement back. And I know that there's no one in the room. It just feels like it. It's just a hallucination, which is pretty hard to tell yourself in the middle of the night if you're scared stiff. But, this is just a hallucination. If you know that it is and you're able to tell yourself that, it's much easier to bear that for a couple of moments until you get your movement back. So in general, if you are experiencing sleep problems, then good sleep hygiene is really important because the more tired you get, the more problems you will have with sleeping. So you actually need to be getting enough sleep every night in order to be able to then do that. So regular bedtimes, enough exercise during the day, relaxation before bed, avoiding alcohol, no screens for an hour before bed, and that just allows your brain to naturally relax a little bit more easily. Making sure that you are warm enough and also not too hot overnight, because overheating overnight will cause nightmares to be more florid. And a really dark and quiet room. And I also love to, this is a personal recommendation, but I also love to recommend a podcast called Nothing Much Happens. So search that up on your podcasts, wherever you get your podcasts. Nothing Much Happens. It's a beautiful podcast. It's just really simple stories. I think the woman who does them puts out a new one very frequently, like maybe couple of times a week, something like that. And they're just lovely, gentle stories. They're not exciting. They're quite sedate stories, shall we say. And lots of my clients have found that really helpful because it gives them something to focus on while they're going to sleep. All right, so if you are having nightmares or sleep paralysis or just insomnia or anxiety about going to sleep, have a chat to your EMDR practitioner about how you can approach this, because it really is very worthwhile resolving these problems. Sleep is so important. If you require a little bit of help implementing this in your practice, feel free to reach out to me for consultation or supervision via my website, emdrdoctor.com.au. And I will just do another little plug about my webinar about shame. So a couple of weeks ago, I held a webinar about shame, and it's now available as an on-demand webinar via my website, emdrdoctor.com.au. So I hope this has been interesting and helpful to you in some way. I will talk to you again next week. In the meantime, take good care. Bye for now.